The Chamber will know of my long-standing concerns about the leadership and culture at NHS Greater Glasgow and Clyde, and today's Health Improvement Scotland report into emergency departments across Greater Glasgow is devastating. Corridor care normalised, frontline A&E staff's repeated concerns ignored, worse still, staff bullied and silenced, and patient care compromised, often with devastating consequences. Does John Swinney think this is acceptable?
First Minister.
First of all, President Officer, may I thank Anas Sarwar for the generous remarks that he has made, and I appreciate the words that he's expressed about our dear colleague. In relation to the Healthcare Improvement Scotland report on Greater Glasgow and Clyde, I don't think that the practice that Mr Sarwar recounts is acceptable. That's why Healthcare Improvement Scotland have responded to the concerns that have been expressed by the clinicians. In relation to I acknowledge the sustained questioning that Mr Sarwar has led on the leadership of NHS Greater Glasgow and Clyde. As he will know, there is new leadership in place that is addressing and committed to addressing all of these questions that are raised in the report. And indeed, Professor Jan Gardner, the new Chief Executive of NHS Greater Glasgow and Clyde, has indicated publicly the commitment she has to addressing those recommendations with pace and at scale to ensure that the issues are properly addressed.
Anas Sarwar.
I've been raising concerns for years with successive SNP health secretaries and First Ministers, but here we are again. This is just the latest report after 29 doctors raised concerns almost 2 years ago, and it exposes serious issues around the culture of NHS Greater Glasgow and Clyde. But it follows the same pattern. Patient safety compromised, staff ignored, bullied and silenced, and when they blow the whistle, the management deny their claims, intimidate them and attempt a cover-up. Staff describe the working environment as brutal and inhumane. They talk of moral distress or being haunted by some patient experiences leading to harm, and they say it's a constant battle to keep patients and staff safe and that there is no support from management. After years of warnings and hollow claims of lessons learnt, why is this SNP government allowing this rotten and at times fatal culture to continue?
First Minister.
Well, we don't accept it is in any way to be acceptable or to be resigned to. That's why Healthcare Improvement Scotland went in and undertook the investigation that they undertook, and it's why the leadership of NHS Greater Glasgow and Clyde are saying today that those issues will be addressed, and they'll be addressed with pace and urgency. And let me use this platform to make it abundantly clear to every health board in the country that the culture that is referred to by Healthcare Improvement Scotland is completely and utterly unacceptable. Now, Scotland has a formidable record in general on improvements in patient safety. Indeed, our patient safety programme is very highly regarded internationally because of the work that it involves. However, the quality and strength of that patient safety programme will be undermined if there isn't a culture of acceptance of the need to tackle the behaviour that the Healthcare Improvement Scotland report highlights. So Mr Sarwar has my assurance that in my communication and that of the Health Secretary to health boards, the contents of that report are unacceptable and they must be addressed by health boards around the country.
Anas Sarwar.
The problem is that patients and staff have heard this before and the culture continues, because this report highlights the unacceptable normalisation of corridor care and patients stuck in ambulances outside A&E. 2/3 of staff surveyed felt patients rarely or never received appropriate and timely care. But for years, the Queen Elizabeth Hospital has been plagued by issues, often with deadly consequences. The most stark is the infection scandal that cost lives. And at every turn, patients, parents and staff have fought for answers but been frustrated by a rotten culture of cover-up. A public inquiry was agreed in 2019. The culture continues. The board was put into special measures. The culture continues. The first NHS board in Scotland to be investigated for corporate homicide. The culture continues. And as this latest report shows, patients are still being put at risk by a failing health board that's been empowered time and time again by this SNP government. It appears this SNP government is more interested in protecting managers and institutions rather than protecting patients and staff. So what will it take for that to change?
First Minister.
So I don't accept that characterisation of the approach of the government, because if that was the case, there would not be an inquiry into the Scottish Hospitals' performance, and there would not have been a Healthcare Improvement Scotland analysis of Greater Glasgow and Clyde. So those are two examples where this government has been prepared to honestly confront real and acute difficulties within our health service, and I would expect that to be the case, and I give Mr Sarwar and Parliament the assurance that that will always be the case under my leadership. We will confront difficulties, we'll confront them openly and honestly to improve the experience of patients. Now, Mr Sarwar said that there was a normalisation of corridor care. Let me make it clear to Parliament, I don't accept that. I will not tolerate that. I will not normalise corridor care. I don't think it's a good idea to have corridor care. So what we have to do is address some of the issues I referred to in my last answer to Russell Finlay of improving the flow of patients through hospitals so we avoid corridor care. Mr Sarwar also said that patients are routinely denied appropriate and timely care. That's not. I accept there will be failings in the health service, but I don't think that is a fair characterisation of the National Health Service, because I think many people experience formidably high quality, professional, loving care from within the National Health Service, and I want to make sure that's the experience of everybody.